Director and also co-founder of Our Bodies Ourselves. She's co-author of Our Bodies Ourselves and a member of the editorial team for Our Body Ourselves Menopause and Our Bodies Ourselves Pregnancy and Birth. Judy has been speaking and writing about a wide range of women's health concerns for close to 45 years and has appeared on numerous national television and radio programs. She served on the board of the National Women's Health Network for more than 14 years and on the board of Public Responsibility in Medicine and Research for 24 years. Please welcome Judy Norsigian.
Well, thank you so much, and I apologize for having this cold, so my voice is even lower than usual. I also bring greetings from the board, staff, and founders of Our Bodies Ourselves. You probably read that article in the Globe on the front page last Saturday, and the crowdfunding has gone well as other things, so I think Our Bodies Ourselves will not be folding, which is good news. They say it takes a village to raise a child, and this is an organization that has had some challenges. The Globe article misrepresented them, but that's all right. It was because of the article getting shortened. But the efforts going into keeping the organization going now are really so wonderful. I want to say that this issue has been an important issue for women's health advocates. Just last month, I was in Washington for the 40th anniversary of the National Women's Health Network, which is a terrific organization, long concerned about this issue among many other women's health issues, and this topic came up. And in thinking about today, I realized that we would have enormous overlap, and maybe my focus should be on some of the history and some of the activism, because there are some extraordinary stories to tell about this particular issue, and they go back further than I had even remembered. That's the trouble with getting a bad memory. I want to let you know that I'm leaving resources here for those of you who are interested in looking further into this topic. As a reminder, that there's a wonderful journal, Reproductive Health Matters, that comes out twice a year, based in the UK, and they have addressed reproductive health issues. It's a wide-ranging journal. It's peer-reviewed, and this is just the index from 1993 to 2001, if any of you want to take it afterwards. I also brought with me some of the earlier editions of Our Bodies Ourselves. This is from 1984. I have one from 1992 as well, because I thought it would be very interesting to look at what we were saying back then. I mean, this is more than 30 years ago. And it's really so true that although we do need to do the science, there actually has been some science done. And there's a strong push now to adopt the precautionary principle of public health, which in this field is more important to adopt than practically any other, because there are going to be confounding variables. There are going to be many ways in which we won't get incontrovertible evidence to make the point that X causes a reproductive health effect, whether in men or women. And thus, we're going to have to take the precautionary approach. The public health activists who developed this decades ago have been trying to get into policymaking circles to get those who make our public policies to think about this, that when you have a preponderance of evidence that's suggesting that a substance in the environment is going to cause harm in some way, you don't wait till you get complete proof, because if you wait that long, you may have done so much damage. So you adopt a precautionary approach. This is politically very controversial, and of course most large companies have railed against it. So I'm going to point out that in this 1984 edition, we did have a chapter on environmental and occupational health. And we began with things like chemicals and radiation, and we went on to talk about the health effects of environmental hazards and include some pretty funny cartoons. If I'd done a PowerPoint, I would have included them. And then talked about environmental hazards in our body systems. And even back then, there was a beginning body of evidence that looked at the reproductive system and talked about toxics that could cause direct damage to eggs, sperm, or developing fetus, or cause mutations in eggs and sperm that can be passed on to later generations. Already we were having some evidence of infertility or reduced fertility, decreased libido, menstrual changes, birth defects. And some of the common causes that we were looking at and trying to study were things like lead, carbon disulfide, ionizing radiation, carbon disulfide estrogens in men in particular, and lead, PCBs, and anesthetic gases, mercury, lead, and DDT. The thing that really interested me when I picked this up yesterday was to see that we had in all of these earlier editions a whole section on how reproductive hazards affect men. And again, we're talking about the early 80s. A recent government study found PCBs in every human sperm sample tested. Environmental toxics can disrupt the production of male hormones in the testes, causing loss of sex drive and impotence. They can also cause problems with sperm production. And it goes on to say some of the things you've heard today already. And then it pointed out 3 bullet points. Men exposed to lead have decreased fertility and malformed sperm. Higher rates of birth defects are showing up in the children of Vietnam veterans exposed to Agent Orange. This herbicide was contaminated with dioxin, considered to be at then the most toxic man-made substance. Use that term advisedly. It can concentrate in the food chain and accumulate in human fat. It can also pass through the skin. And then DBCP, dibromochloropropane, a pesticide, was found to cause dramatically decreased sperm counts in men who work with it or in its manufacture. The men in one California factory noticed that none of them had fathered children since they started working there, and they demanded fertility tests. Many of them were already sterile. This is a while ago. We still see exposures to fairly stiff toxicants in many workplaces, and we still have a long way to go. It's why groups like MassCOSH here in Massachusetts and all around the country is so important as they try to reduce such exposures to both men and women in the workplace. And I won't say much about the issue for women, but one of the things that struck me is that as we went around the country and looked at activism, this thing, Agent Orange, I mean, we had these phenoxy herbicides that we basically carpet bombed Vietnam with. So we had 2,4-D, 2,4,5-T. They were phenoxy herbicides, extremely toxic. They had huge health effects, reproductive health effects on many of the women in Vietnam. That has been long studied, although challenged in many cases. But what happened was interesting is that they brought 2,4-D and 2,4,5-T back to the U.S. to use because, of course, if you're a company, you want to market your product wherever you can. And so it was used a lot in the Northwest. And we discovered a group called NCAP, the Northwest Coalition Against Pesticides, mostly mothers and mostly women who noticed that there were really strange reproductive outcomes, lots of miscarriages, even a few malformed children, babies who were born. Really serious questions were being raised about what was going on in our community that we had so many problematic reproductive health outcomes. And they put 2 and 2 together and started to realize it was the spraying of 2,4-D and 2,4,5-T in their communities. And they, of course, worked hard to get rid of such spraying, but you can imagine that it was done in other communities elsewhere where people didn't organize. And we've got many examples of this in Love Canal and here in Massachusetts, the Grace chemical incident. And when this went to press, we'd already had the Bhopal disaster. And I actually want to read something about that. Because we hooked up with the UN group that was working to do something about Bhopal, particularly around making Union Carbide pay a little bit more than the few $100 million that they ended up paying. It never really was what they should have paid, to deal with the horrible outcome. So this is another example of dumping hazardous products, waste, and production activities in other countries. So you probably all remember the Bhopal India nightmare in 1984. It was labeled by the Bhopal Action Resource Center at the UN as, quote, a Holocaust unprecedented in the annals of man-made industrial disasters. 7 years after the toxic gas leak from the Union Carbide pesticide factory in Bhopal, 400,000 victims continued to suffer from untreatable or fatal illnesses. Some of them were reproductive. A 1990 study showed that the death rate for these victims is twice that of those unexposed to the gas. And there are other stories since then, and I'm sure you read about them when they happen. But it's very interesting that even with these kinds of major events, it's been so hard to adopt what we would like to see as better precautionary approaches. The other thing I want to say about fertility is that you heard probably about Rachel Carson earlier today. You probably heard about Our Stolen Future, which is a book by Theo Colburn and her colleagues. And they were beginning to look at the xenoestrogens in the environments, the toxic substances that were beginning to have an effect in wildlife. In fact, one of the best early studies was the alligators in Florida. Where was it? The Everglades, somewhere in Florida, where the penises in the alligators were getting very, very tiny. And those studying them were trying to figure out what was going on. And it turns out that in that environment, there had been a fair amount of contamination with what we now call xenoestrogens, these sort of substances, chemicals that behave like hormones in the human body. They lock into estrogen receptor cells and they can cause havoc. So that the fertility rates were down. Of course, the penises were small and couldn't do who knows what else was going on. They did something interesting in Florida, which is years later, they started to study the young men in some of the college populations. And they found some interesting and problematic outcomes there, and I don't have that in my head right now. It wasn't that penises were shrunk. It wasn't anything like that. But it was things like sperm counts and possibly epididymal abnormalities. But there was an effect that seemed to be measurable in the young men who were in that same region where the alligators were. And it's caused, there could be all sorts of reasons for this. And I know that these studies have been done elsewhere in college male populations with different outcomes, but it's something to be concerned about, especially as we see more and more couples seeking infertility treatments, and in some cases, it's male factor infertility that we're looking at. So I want to mention that there are lots of stories like this, coal mining women. There are great stories in the annals of women's health activism. Many of these look at reproductive health effects. They're in books, they're on the internet, they're worth looking at, and I'm going to leave these two editions of Our Bodies, Ourselves if you want to look at a little bit of what was here with some of the citations that we have at the end of the chapter. And I want to jump to the present a little bit and talk about a wonderful example of activism that's pretty current. And it was written about in the Seattle Times a couple of years ago. And the title of this article was Consumer Advocates Turn Heads in Taking on Cosmetics Industry. And as you well know, we have lots of paths for these toxicants, well, three major ones getting in our body, and one is the skin, and one is ingesting, you eat, and one is inhaling. And when you think about the cosmetics that we use, they pretty much use all three avenues for getting inside our bodies. And they're ubiquitous. Personal care products are used by so many women. So this article begins, it began more than a decade ago with 4 women who wondered whether the hairspray, perfume, and shampoo they were using every day were safe. Their quest to find an answer led them to their neighborhood drugstores where they spent hours reading the labels on beauty products. What they read disturbed them. Lists of chemicals and ingredients whose names they couldn't pronounce. This bootstrap effort grew into a national movement, the San Francisco-based Campaign for Safe Cosmetics. How many have been online and seen the work of the Campaign for Safe Cosmetics? See, it's a good number of you. They've transformed the way consumers shop for personal care products, pushed the cosmetics industry to change the way it makes products, pressured lawmakers to call for more oversight, and moved Walmart, the world's largest retailer, to announce a policy last month, this was in September of 2013, banning some harmful chemicals from beauty merchandise. They really moved the needle on this, said Tracy Woodrup. She's the director of the Program on Reproductive Health and the Environment at the University of California. And this PRHE is really, in my mind, one of the best shops in the country doing research on environmental insults, effects on reproductive health. And I'll say a little bit more about what they're studying right now, and they have a good website as well. The way we think about cosmetics and chemicals has changed because of the work they did, said Tracy Woodruff. After setting up their headquarters in San Francisco, they tapped into one of the country's most environmentally progressive areas, finding allies among the activists there in a political climate that embraced toxic chemical regulations. The campaign launched the first large-scale grassroots challenge to the country's $60 billion beauty products industry, and in 2005 helped drive passage of the California's Safe Cosmetics Act. It's the only law of the kind, I think, in the U.S. still, unless something passed in the last year or so. It requires that cosmetic companies disclose to public health officials the ingredients in their products sold in California. The fact that the campaign is housed in the Bay Area has everything to do with the success we've had over the past decade, said Janet Noodleman, an early leader in the Safe Cosmetics movement and program director at the Breast Cancer Fund, which shares its office with the campaign. And the Breast Cancer Fund is one of the really important groups out there looking at environmental toxics. So does Breast Cancer Action, which is nearby in San Francisco. The Personal Care Products Council, the industry trade group, declined to answer questions, saying in an email the questions, quote, would require considerable time as they cover a multitude of complex issues. That's a creative evasion of the question. The Council's website says that manufacturers, quote, utilize the best science and latest available research data to substantiate the safety of a cosmetic product before it's marketed, and comply with guidelines established by scientific and regulatory bodies around the world. They say that more than 11 billion personal care products are sold each year, with about 150 reported adverse reactions, namely skin rashes or allergies, which it says make beauty products safer than food or medicine. Well, of course, how many of you know people who have an adverse product from a personal beauty care product who go to some website and report it? Raise your hand. It's just not done by the public. Most of the public doesn't even know where it might make a complaint. Concern about a group of chemicals called phthalates touched off the campaign, a class of man-made chemicals that are common in many personal care products. And even in low dosage, they can cause early onset menopause, infertility in males, and you've heard about this already. The American Society for Reproductive Medicine and UC San Francisco, which is where this program Tracy runs, have actually written quite a bit about this. There's also a way in which their campaign touched off interest in lots of other larger groups, like the Environmental Working Group, EWG, which is based in Washington, D.C. One of their staffers read something they had done and went to the nearest drugstore to look up personal care products and start to think about this. And chemicals aren't always disclosed, so it's really hard for you to know. EWG has actually created a good website where they tell you the results of their lab tests of a lot of these personal care products, what they found in them, whether they might be potentially harmful, including in terms of reproductive health hazards. And then they do something which is really neat, which is they give you alternative products you can buy. They don't just tell you, don't buy this, don't buy this. They give you some alternative products that pretty much do the same thing. So if you can avoid the particular chemicals in the product that you were using and that you just looked up at the EWG website. More than 12,500 chemicals are used in cosmetics now, so it's really not easy to figure out everything you need to know. There are many groups out there that are concerned about this. Even the American College of Obstetricians and Gynecologists has been training OBGYNs, the American College of Nurse Midwives, the Endocrine Society, Physicians for Social Responsibility. Many groups are now trying to get their membership to think more proactively about these issues. And you have to remember, you just heard a little bit about the DES story. Well, diethylstilbestrol, when it came out, they were using it to prevent miscarriages in women, and you know something, it wasn't even effective for that use, so this thing was a really awful thing. When Arthur Herbst and colleagues at Mass General did the research that led to the article in the New England Journal of Medicine, which over time caused physicians, but not as quickly enough as you'd like to think, to stop using it for an ineffective purpose anyway. What we have learned is that it isn't just the daughters and the sons of women who took DES when they were pregnant, but it's also, as you pointed out, the grandchildren as well. So very often what we do acts, in terms of having an insult in the human body, acts as a mutagenic agent. It can affect procreative possibilities. If you affect the germline cells, you affect future generations. This is not a small thing. It's not something we just stop, so easily. We have to take a much better approach to prevention here. So I think I'll just skip that because I think you covered all that earlier. I want to say also, if nobody has mentioned it earlier, Sandra Steingreber's work, several of her books are particularly good to read about these issues. And they marry important storytelling with what we know in the science. So a little bit about the UCSF program on reproductive health and the environment. They have a multidisciplinary approach, and they want to expand our understanding of sources and exposures to environmental chemicals during development and the effect on health. And this is not easy because, you have to figure out, what's the exposure, then you have to figure out how it gets in the body, you have to figure out what's the dosage, then you have to figure out what's the uptake, and the uptake can be different in different human beings. And so, like cigarettes, not everybody who smoked got cancer. The same happens with these reproductive toxicants, that not everybody who's exposed, even to the same level, will have the same outcome, and that's why we need really big population studies. So they identify the major sources of exposures to chemicals that are ubiquitous in our environment in order to support more effective strategies for reducing and preventing harmful exposures. They want to increase our understanding of fetal exposures to chemicals during key periods of prenatal development in order to improve the accuracy of health-based decision and policy making, and we need better epidemiologic and clinical research as well. And they want to illuminate the potential impacts of prenatal exposures on health throughout the life in order to expand our understanding of many common chronic childhood and adult diseases and disabilities. One of the most frustrating things when you go to study these substances that have reproductive health effects is that the effects may be delayed by years and even decades. And so unless you're doing some longitudinal research, you'll never find that out. So they're now doing a pregnancy and work study, trying to characterize the hazardous chemical exposures that pregnant women encounter through their jobs and their hobbies through use of a brief self-administered questionnaire. Sorry about that. They're getting some funding from the California Department of Public Health. They're doing maternal and fetal chemical exposures research, trying to figure out if we can get better handle on the environmental contaminants when they get in the body, how they affect us, and they're working with the Formative Children's Center on that. The chemicals in our body studies, this is in collaboration with the California Environmental Contaminant Biomonitoring Program. They're going to do a biomonitoring study of pregnant women and their newborn infants. The pilot study will measure levels of over 100 chemicals or chemical metabolites in pregnant women in umbilical cord blood collected at birth. They're also administering an exposure assessment questionnaire and conducting a pilot study of reporting back monitoring results to study participants. They're assessing cumulative burdens of chemicals nationally in pregnant women. They're using NHANES data it's collected by the CDC. They have something called Research Evaluating Environmental Exposures from Everyday Living, REVEAL, REVEEL. They have one on PCP, PBDE, and thyroid disruption during second trimester of pregnancy. They have a meiosis study, the role of endocrine disruptors and chronic stress on pregnancy outcomes. This investigates the independent and combined effects of PBDE flame retardants and subjective and biological measures of chronic stress on pregnancy outcomes, including hypertension disorders and preterm births. You know, this business of flame retardants in children's clothing, who here knows about the history of that and how many years it took? How many years did it take to get it out? Do you remember, Phil?
84 until 2013.
Yes, I was going to guess close to 20. And we did so much harm to small children using flame retardants in their clothing. The research was coming out. The researchers I remember them going to state-level hearings. I remember them speaking at APHA, American Public Health Association, about their work. They were getting nowhere fast. It took enormous amount of people power and organizing to finally get rid of flame retardants in children's clothing. Obviously, in couches and furniture, I mean, there are many ways in which we're exposed. It reminded me of the study of the struggle, which was even earlier with, was it Needleman, Dr. Needleman, who did the work trying to get lead out of paint? He was pilloried by the paint industry in a way that almost cost him his career. He told that story to an American Public Health Association audience about 20 years ago, and I will never forget it. You can find his story online. It's now in chapters in books. But I consider him, and I think he was originally a pediatrician by training, one of the heroes in terms of, going after substances in the environment that are wreaking havoc. And there's also the California Breast Cancer Prevention Initiative, which they're working on, Marge Plum and Marion Cavanaugh Lynch, and it's in getting funding from the California Breast Cancer Research Program. What is also interesting, I just want to mention this about this center, is that they have, at the end of their list of research studies they're doing now, conflict of interest research and environmental health. Our long-term goal is to develop an evidence base to inform development of conflict of interest policies for non-clinical research. In pursuit of this goal, the objective of this application is to examine the association of research funding source and financial conflicts of interest of investigators with the design and reporting of non-clinical studies. You know from all of the work we've done in the drug industry and with those who have conflicts of interest that the outcomes of clinical trials and other kinds of trials that look at particularly at drugs are definitely affected by the fact of a conflict of interest on the part of the principal investigator. So I think we definitely have to keep an eye open to who's doing what. Laura's doing great work and doesn't have the kinds of conflicts of interest that we see elsewhere around the country. And we have to really train everybody to look at who funds the research, where's the money coming from, and whether or not there is some distortion going on here, either in the way data are collected, the methods that are selected, but also the reporting outcomes. I just want to mention something about PCBs. Along with DES, PCBs are one of the best examples of endocrine disrupting chemicals. And it was a while ago that we saw that there was a relationship between PCBs and endometriosis and reduced fertility and decreased semen quality and miscarriage and altered puberty development and reproductive tract malformations. So this is a substance that has really been so important that those of us who are activists take on in terms of trying to eliminate from the environment. Some of the worst chemicals, as we learned from DDT, are persistent in the environment. So once we stop making more of them, we're not done with the damage that they do. They continue to cause harm. I want to close with just a couple of comments about other ways in which we can maybe do something to raise our consciousness and also stop the harm of substances getting into our body. Many young women think that silicone gel breast implants are safe. Actually, we've never done the due diligence to study silicone breast implants, especially longitudinally, in a way that the FDA, the Food and Drug Administration, had asked for 20, 30 years ago. It still hasn't been done. There's some wonderful articles written about this. So here we are with this issue, and I will say a very similar issue is an issue that we confront when young women go into some of these fertility clinics and offer to provide their eggs for infertile couples, and sometimes go in and get their own eggs harvested and then frozen for themselves for later use. Both of these are great examples of where absence of evidence of harm is not the same as proof of safety. Something so important to remember. We have a lot of anecdotal evidence, a lot of disturbing evidence. In fact, a lot of it is actually described in this wonderful documentary called Absolutely Safe, done some years ago by a wonderful documentarian, and we've been showing this in campuses around the country. I think we showed it at Northeastern a few years ago, but I'm leaving it here for anyone who would like to show it, because it shows how the FDA works. It shows how scientists work. It shows how scientists work. It shows the political process that we need to understand when we start tackling these issues. So it's a great example. And as we see the numbers of young women getting silicone gel breast implants, we're talking about augmentation, not reconstruction after breast cancer. This is totally preventable, some of the harm that these young women experience later. And the harm is not well enough quantified, not well enough studied even to this day. Those are the kinds of issues we have to kind of keep our antennae out for. And when you see, the canary in the mine, so to speak, and you see evidence of maybe something causing a problem, you're not sure, rally the forces to start studying it before it harms too many people. So with that, I'm going to stop, and maybe we can have some more conversation, and I'll read the other things later if there's time. So.
Thank you, Judy. Do we have questions from the audience?
Phil, why don't you, Phil, would you pass these around? Anyone who wants to take one can take one.
Thank you so
I think
much.
I lost the marker in one of them, but you can find it. It's chapter 7.
Thank you so much for that talk, and it's really distressing to hear how slowly government agencies react to news of things that impact women or children. Like all the men in Congress were not once upon a time children, and it's like they forget that. But it is in Boston in around 2007, I think, that the Vioxx studies came out, that Vioxx had some correlation with heart attack. It was far from 100%. And the FDA pulled that drug in months, and it's head spinning, that all of a sudden the doctors couldn't prescribe it. And, I don't know if there's any comparative studies, like how long does it take to get government action on something that's a male issue versus government action on something that's a female issue?
Well, I don't think, maybe earlier I would have thought this is kind of pure sexism. I don't think that's what's operating now. I think it's pure money. Because if you look at the Vioxx issue, what happened is that Merck didn't tell the whole truth. They're only required to bring 6 months of data in. You didn't see the effect till the next 6 months worth of data. They had that full year's worth of data, and they didn't share it. It was David Graham, who was a whistleblower at the FDA. Read his story, because he ended up being punished for this. Interesting how scientists at the FDA, there's more than one example, when they do their job well, because of the way the drug industry works, and because there's this revolving door, and some of the higher officials are friends with drug company leaders, somehow it doesn't always work out the way it should. That was horrendous. And when members of the FDA advisory committee learned that they had been duped, that the information was there, and they were only given the first 6 months, they were all over the New York Times. They had to act very quickly there, because this is outright dishonesty, and you should have provided the data that you had already in hand. They would never have recommended approval had they had that data. And there are other examples like this. Now, there are the thing about Lupron, leuprolide acetate, which is a very controversial drug in women. It's used for treating endometriosis, for which many say it's useless. It's also been used for palliative treatment of end-stage prostate cancer in men, also for something called central precocious puberty in young people. Its most common use, that I think where it's shown usefulness, has been to stop endometrial bleeding. It's fibroid-associated bleeding in mostly menopausal age women. And it's got approved uses. What's so ironic is that it's very popular, and I think for a period its most common use, except for in men, was in the infertility clinic setting, where it was used to shut down the ovaries before you have controlled hyperstimulation to gather these multiple eggs, either for women undergoing IVF, in vitro fertilization for themselves, or for the young women who need 5, 7, 8,000, or if they're an Ivy League student, they can get 80,000, to pay for their college tuition. So young women were taking, particularly this drug. I mean, there are other drugs now that have FDA approval. This is still used off-label in dozens and dozens of clinics around the country to basically suppress ovarian function before there's hyperstimulation. You produce multiple eggs. That's the idea. And that was never approved by the FDA for that particular use. So we have many examples of drugs being used off-label. This one does seem to have some reproductive health effects, and we don't need to get into it now. But we have a lot about this at our website. There's a group of young women who have been egg donors, and some still are, some aren't, and they have a website called We Are Egg Donors, and one of them guest blogged for us a couple of times in the last few years. So young women are starting to organize, and they're not saying you shouldn't do this, because many of them still want the option of going in and providing eggs for whatever reason, not for themselves, but for somebody, an infertile couple, and they like the money, but they're really angry. They're not given what we would call reasonable informed consent. They're not given what we do know, let alone nobody's telling them there's a lot we don't know. So these are the kinds of challenges we have. You think sometimes that everyone's looking out for you. You go somewhere and it's not necessarily true. Know the source of your information. Go online. Get trusted sources. Try to find the groups that don't take drug company funding. Our bodies are one of the reasons we're in trouble is we never took drug company funding, and they would have loved to give it to us. But there are groups out there that have, because it's the only way they could have survived. But eventually you don't bite the hand that feeds you, and that's something important to think about if you're going to be an activist or an advocate. You have to think about what your funding sources are. Just look at politicians. Look at the ridiculous situation with climate change and what we know we need to do. But politicians are basically in the pocket of the fossil fuel industry because of all the money coming their way.
We have time for one last question.
It's not necessarily a question, it's more of a statement. You mentioned something about the EWG and how they you can look up a specific cosmetic or personal care product. I don't know if it's them or a different agency or company or whomever, but there's actually an app that you can download onto your phone called Think Dirty, and you can scan up the barcode while
Yes.
you're standing in CVS. Is it them?
I think they did an app, and I don't know what they called it. It might be their app. You could find out easily by going to the website. I'm not keeping close track of the latest things because we've all been in sort of save our bodies ourselves mode the last umpteen months, so I'm not up to date. But there are actually several apps. I know for breastfeeding moms there are some interesting apps out there now. Yeah, I mean, ever since the women in Michigan, they don't eat the Great Lakes fish, and we still think that even though these toxicants can really concentrate in breast milk, unless they're really high levels, it's better to breastfeed than not breastfeed, because practically no young woman breastfeeding now is free of something not so good in her breast milk. But she's got a lot of good stuff in there too. And that data are really solid. It's been very distressing, actually, to see, I think, industry-funded efforts to make young women think, oh, breastfeeding's not that important, you don't need to breastfeed. And there are these, like, breastfeeding, what do they call them, Gestapo types. Nobody is doing that to women. There are a few, maybe. Mostly we try to provide support and have workplace-friendly, policies so women can pump at the workplace. And but there's no question that we need to be promoting breastfeeding and also reducing environmental exposures. So, our little babies aren't ingesting horrible things when they nurse with their moms.
I'd like to say something to the question. In regard to safe cosmetics and personal care products and even household products, one thing that we are doing at RSD, since over the summer, I had a student who went to all sorts of different stores, taking pictures, comparing different products, and so we are making almost like a booklet, just with prices, pictures, ingredients, and some we don't have ingredients because when they have products that we can't pronounce, so sometimes when companies they will not listen. But we want to make it in a way that's user friendly for people to have access to this sort of information, because it would take a lot of time and having the knowledge to know which company, which organization, what are the stores. But we've gone to places like map counters, Whole Foods, where you can find vegan-based lipstick, vegan-based products, to CVS, to Walmart, to Stop and Shop, and just really making a listing of things that you use to clean your floor, from soap that you use for your face, or soap for whatever, from toothpaste. So, but we're really trying to put everything together to make it easier for people to have access to, along with all kinds of websites that people can access. So if anyone is interested, you can send me an email. It's going to take a while. I always say that we are emerging, and we're still emerging as a small nonprofit, super tiny. But people can send me an email, and I will put their names on a list, and when it's ready, I will send the information to them. Hopefully we can, at one point, put it on our website.
Great.
Thank you so much.
Thank you.